Hi everyone, my name is Catherine Huggins and I am a graduate student at the Rehabilitation Institute. I completed my undergrad at Penn State University, where I also started my grad work. I moved to West Kentucky and transferred into the off-campus Trinity program here at SIU in an effort to balance my career and my education. Currently, I work under Dr. Becky Nastali as a BC ABA. Dr. Nastali graduated from SIU Carbondale and has since opened her own clinic to treat children with Autism Spectrum Disorder. With the growing prevalence of Autism Spectrum Disorder, or ASD for short, it is likely that we all share something in common. We all know at least one person who is diagnosed with ASD. 1 in 68 children are diagnosed with ASD. It is listed as a serious developmental disability defined by persistent deficits in social communication and language, restricted and repetitive behaviors, developmental delays, and other symptoms that cause clinically significant impairment in most areas of functioning. The growing prevalence of ASD establishes an imperative need to investigate developmental skills in children. This brings me to my position in behavior analysis and therapy. While I am not yet published in the literature, I have contributed to the applications of using behavior analysis and therapy to treat developmental disorders. In high school, I was a teacher's assistant in a special education classroom. In college, I pursued psychology. In 2013, I landed a job as a behavior support staff in a charter school. In 2014, I became an RBT. In 2016, I became a BC ABA and an LABA in the state of Kentucky. This chain of events has directed my education through the years and now has inspired my thesis. It is safe to say that I have contributed to the real-world application of learning and using behavioral principles to treat ASD, but my thesis acts as a platform to begin my contributions into literature. A true symptom of ASD is the developmental deficits that are witnessed in day-to-day living. My clients show signs of this every single day. In fact, more specifically, most of my clients are between the ages of 4 and 6 years old, showing serious language deficits. Because of this, I started investigating language and how it relates to ABA interventions. This is what led me to my research question: can sequential reflexive relations be taught to young children with ASD? Before I continue, I want to say thank you for taking the time to read through my thesis, to watch this video, and to assist me in my journey of pursuing continued education in the field. The presentation will be structured as follows. First, I will briefly introduce the study. Then I will break down various chapters, the introduction, methods, results, and discussion. I'll wrap up the presentation with concluding remarks about the significance of my work, how it can be applied, and what this implies for my future. The present study investigates the language phenomenon of stimulus equivalence in children with autism spectrum disorder. Stimulus equivalence is comprised of 3 main concepts: reflexivity, symmetry, and transitivity. Specifically, the researcher evaluated the ability to teach, test, and transfer sequential reflexivity across 2 participants. 2 4-year-old children diagnosed with ASD participated in the study. Methods were derived from the program Reflexivity Pictures 2A, along with a yes-no response modification to suit both of the participants' current level of developmental skills. The research suggests that the PEAK-E curriculum was effective in training and testing both children to establish reflexivity across stimulus set 1. In addition, both participants demonstrated a transfer of stimulus function to an untrained stimulus set 2 once the trained stimulus set 1 was mastered. Skinner provides a foundation in his book Verbal Behavior for growing literature in treating children with ASD and other related disabilities. The Centers for Disease Control and Prevention write that applied behavior analysis is a behavioral approach to treating ASD that is widely accepted among healthcare professionals, schools, and treatment clinics. ABA treatment encompasses many different intervention strategies and addresses the challenging behaviors as well as the language and social deficits exhibited in children with ASD. Although challenging behaviors are not to be ignored in children with ASD, the current study focuses on the language deficits associated with the disorder. Without the proper early intervention, developmental language skills can suffer greatly and in some cases regress back to earlier stages of development. Of the many dimensions of human language, researchers suggest that stimulus equivalence is the core of a behavioral account of language. Stimulus equivalence has been of interest to psychologists since 1964. There are three main terms in stimulus equivalence: reflexivity, symmetry, and transitivity. For lack of time, I will only discuss the term of interest, reflexivity. Reflexivity occurs when each stimulus must be conditionally related to itself. For example, spoken words to spoken words, written words to written words, pictures to pictures, and so on. Many researchers overlook the reflexive relation, expressing a need for the current study. Reflexivity is recorded as the most basic term in stimulus equivalence, but must be learned before establishing other areas of relations. One might assume then that if the equivalence relations are not established in children, they may lack the skill sets to further respond relationally in other areas of coordination, opposition, distinction, comparison, temporal relations, and spatial relations. The published research has failed to investigate reflexivity and its significance, as well as variations of reflexivity such as sequential reflexivity. Sequential reflexivity warrants a need for further investigation in itself due to the complexities of matching in a sequential order. Further, the current researchers suggest that reflexivity is of utmost importance to establish at a young age in order to explore language and develop relations to stimuli in the environment during the early critical developmental stages. This is especially true when considering the developmental delays often seen in children with ASD. The Promoting the Emergence of Advanced Knowledge Relational Training System, otherwise known as PEAK Equivalence Module, was used in the current study. It contains an introduction compiled of background information, instructions, programming details, accommodations and adjustments, recording suggestions, data analysis, a pre-assessment, and program instruction sheets. Each program sheet includes the goal, materials needed, instructions per phase, and data entry per multiple exemplar. Two children, one female and one male with ASD, participated in the study. Emily is a 4-year-old female and Chris is a 4-year-old male. A document review was conducted on both participants prior to conducting the study. Behavior plans were released upon parent consent and obtained from the clinic's records in order for the researcher to gain additional information about the participants. Both participants have older siblings that are diagnosed with ASD. As well, both participants are diagnosed with severity level 3, requiring very substantial support. In addition, both children receive early intensive ABA therapy 20 to 30 hours per week in a clinical setting. The behavior plan suggests that Emily engages in challenging behavior which impedes on her ability to function at the level of her same age peers. The challenging behavior addressed in the behavior plan include tantrums, self-injurious behavior, and physical aggression towards staff and peer in the form of pinching, kicking, hitting, and squeezing. It is also reported that Emily is nonverbal and is not potty trained. Outside of ABA services, Emily goes to a daycare and does not attend school at this time. The document review for Chris revealed challenging behavior in the form of tantrums, self-injurious behavior, and physical aggression towards staff and same-age peers in the form of biting. Like Emily, Chris is nonverbal. In addition to ABA services, Chris receives speech therapy services and attends preschool at the local elementary school. Preferred items were identified for both participants using various assessments in the individual behavior plans. Participants were both previously assessed using the Verbal Behavior Milestones Assessment and Placement Program within a year of the study. The VB-MAP is an assessment-based program used to identify a child's abilities in terms of various developmental skills. In addition, the VB-MAP suggests typically developing age ranges for a time a child may acquire these skills. Emily scored a 41.5 out of a possible 170 points, which places her developmental skill level comparable to children aged 0 to 18 months. Chris scored a 60.5 out of 170, which places his developmental skill level comparable to children ages 18 to 30 months. Both participants were assessed by the researcher before conducting the study using the Peak-E pre-assessment. The type of relation reflexivity section of the pre-assessment was the only portion of the test that was administered. Emily scored a total of 2 points out of a possible 12 on the pre-assessment. Likewise, Chris scored a total of 2 points out of a possible 12 on the pre-assessment. Both participants demonstrated reflexivity picture to picture. When taught to match a sample picture A with an identical picture B, the participant is able to match the identical same picture to the original picture. Other areas of reflexivity that were assessed include textual matching, objects, money, auditory words, tactile matching, olfactory matching, and gustatory matching. Both Emily and Chris were unable to complete the other areas of reflexivity listed above. The study took place in a clinic designed to offer ABA therapeutic services for children with ASD. All sessions were conducted in a one-on-one setting at variable times throughout the day with the researcher and the participant. The participant sat across the table from the researcher. Additionally, an RBT was present in the workroom while sessions took place in order to calculate IOA. On occasion, Emily's mother would stand in the room and observe the trials while they were being conducted. The workrooms were very plain with minimal distractions. Only the required materials for the study were in the workroom. The materials used in the study were provided by the Peak-E module program Reflexivity Pictures 2A. The materials included 2 stimuli sets of the same picture cards with a picture on one side of the card. Each set contained 2 copies of one identical object. Pictures in set 1 included lemur, raisin, and speaker. Pictures in set 2 included snowflake, tree, and rainbow. Other materials used in the study were a yes picture, a no picture, a clipboard to carry the materials, data sheets, and preferred items that provided reinforcement to the participants for correct responses during training phases. Various preferred items included the iPad, wooden fruit set, train set, Play-Doh, books, music box, small character figurines, and toy cars. As a side note, a yes picture and a no picture were added to the study as a modification due to the developmental level of both participants. A multiple baseline design across participants was used in the study. Both participants received an A, B, C, D design. The A phase was a baseline phase. The B phase was training stimulus set 1, which was a differential reinforcement of alternative behavior and prompt phase. The C phase was a second phase of training stimulus set 1, which was a differential reinforcement of alternative behavior and no prompt phase. The D phase was a transfer phase to stimulus set 2. The independent variable was the Peak-E reflexivity program. The dependent variable was the percentage of correct responding, within 5 trial blocks in each phase. Percentage of correct responding was calculated by summing the percentage of correct responding per trial and dividing by the number of trials in each phase. Inter-observer agreement was assessed for 50% of trials and resulted in 100% agreement. Percentage of non-overlapping data was also conducted to assess the variability in data across participants. In the baseline phase, reflexivity was tested for both stimulus sets, 1 and 2. For Emily, the researcher presented 5 trial blocks of stimulus set 1 for 2 sessions. Then the researcher presented 5 trial blocks of stimulus set 2 for 2 sessions. For Chris, the researcher presented 5 trial blocks of stimulus set 1 for 3 sessions. Then the researcher presented 5 trial blocks of alternating stimulus set 2 and set 1 for 3 sessions. Prior to running the 5 trial blocks in the training phases, the researcher conducted a brief free operant preference assessment in order to establish a strong motivating operation to complete the training 5 trial blocks. Highly preferred items reported in the behavior plans were presented in front of the participant, and the participant pointed to which item he or she wanted. In the DRA plus prompt phase, training was conducted using picture cards from stimulus set 1. The DRA plus prompt phase procedure was as follows. The researcher presented a yes picture, a no picture, 2 pictures from stimulus set 1 in sequential order, and presented the test probe, are they the same? The participants were provided with reinforcement for correct answers and were prompted for incorrect answers. Mastery criteria to progress to the next phase of the study was 80 to 100% correct responding on 3 separate 5-trial blocks. In the DRA no prompt phase, training was conducted using picture cards from stimulus set 1. The DRA no prompt phase procedure was as follows. The researcher presented a yes picture, a no picture, 2 pictures from stimulus set 1 in sequential order, and presented the test probe, are they the same? The participants were reinforced for correct answers. No prompting was involved in this phase. The participants were given 5 seconds to respond before presenting the next trial. The transfer phase was identical to the DRA no prompt phase except that the researcher presented the test probe and pictures from stimulus set 2 in sequential order. In addition, no reinforcement was delivered during the transfer phase in order to most accurately get a depiction of the participant's current rate of correct derived relational responding. Mastery criteria for completion of this phase was 80 to 100% correct responding on 3 consecutive 5-trial blocks. The results of the present study are shown in the figure. Baseline data suggests that neither of the participants were able to establish the reflexive relation. Both Emily and Chris responded with 0 correct responses. In the DRA plus prompt phase, each of the participants achieved mastery criteria of 80 to 100% correct responding for the reflexive relation of stimulus set 1 on 3 separate occasions. Chris's mean PC was 32.3%, and Emily's mean PC was 50.5% during the training phase. Additionally, the data suggests that Chris met mastery criteria in less 5-trial blocks than Emily. Chris completed the training phase in 26 trial blocks, and Emily completed the training phase in 44 trial blocks. The graph suggests several trial blocks with variable responding for both participants. Possible explanations for this will be addressed further in the discussion. Upon completion of the DRA plus prompt phase, both participants reached mastery criteria of 80 to 100% correct responding for the derived relation of stimulus set 1 in the DRA no prompt phase. Chris's mean PC was 65% and Emily's mean PC was 60%. This phase took exceedingly more time to complete once the relations were established. Chris completed this training phase in 36 trial blocks and Emily completed this training phase in 98 trial blocks. It is important to note that Emily achieved 100% in numerous 5-trial blocks before the researcher transitioned to the transfer phase of the study. Due to the inconsistency of responding, the researcher continued in the training phase until the participant established a more consistent rate of correct responding. The results in the transfer phase suggest a reliable reflexive relation of stimulus set 2. Both participants reached mastery criteria of 80 to 100% correct responding. This phase was completed in a small number of trial blocks, suggesting a transfer of reflexive function using stimulus set 2. Chris's mean PC was 88% and Emily's mean PC was 93.3%. Chris completed the transfer phase in 5 trial blocks and Emily completed the transfer phase in 3 trial blocks. The P&D of Chris and Emily's data is 71%. Therefore, the data between Emily and Chris did not overlap for approximately 71% of the study. This will be discussed further in the limitations of the study. The results of the present study extend the literature on stimulus equivalence through reflexive relations in children with ASD. The present study continues the literature on language. Further, the present experiment exemplifies previous studies that have been conducted on the efficacy of the PEAK-E module to train derived relations in children with ASD. The experiment provides data to suggest that the PEAK-E module is effective in training and transferring derived relations. What separates the present study from current literature is that it is the first study to investigate sequential reflexivity in young children with ASD. While mastery criteria were met, the present study is limited in that only reflexivity across pictures was assessed, trained, and transferred. The PEAK-E includes a potential for further investigation of reflexivity in the areas of objects, money, auditory words, tactile matching, and olfactory matching. Future research may conduct a multiple baseline design across participants that assesses, trains, and transfers reflexivity across the senses. The P-ND of 71% suggests two variably different responding from both participants. This is due in part to the participants being in different phases at different times. The DRA no prompt phase took exceedingly more trial blocks to master than predicted for Emily. In addition, both Emily and Chris presented variable PC scores during this phase. This could be due to the developmental barriers reported from Chris and Emily's behavior plans. Alternatively, this could be a result of not providing prompts for incorrect answers, creating a learning history of touching the incorrect answer with no consequence. Other limitations of the present study include certain barriers of the participants. Both participants are diagnosed with the most severe level of ASD, thus greatly impacting their developmental skills and rate of skill acquisition accordingly. Additionally, researchers suggest prerequisite skills for derived relational responding. These prerequisite skills include establishing preference assessments, on-task behavior, generalized imitation, attending in others, and simple and conditional discriminations. During their free operant preference assessments in the training phases, both participants successfully identified preferred items when asked, "What do you want?" Therefore, it is assumed that their prerequisite skill had been previously acquired. With that said, it should be noted that a participant may select a preferred item, but the preferred item may not be desired enough to complete the requested task. A preferred item doesn't entail reinforcement, and although the researcher made efforts to establish motivating operations, it may not have been present in some of the trials with lower PC in the training phases. From the prior assessment VB-MAP conducted before the study took place, both participants met mastery criteria for generalized imitation. Also from that prior assessment, it was recorded that Chris could complete simple and conditional discriminations, and Emily could not discriminate between two items. This may help to explain why Emily's training phase and testing phase required more trial blocks to meet mastery criteria. As well, the developmental age of both participants was significantly lower than the same aged peers, and this could factor into the explanation for longer trial blocks than one would predict. In addition to their developmental age, the participants were both nonverbal. The researcher modified the program to meet the needs of nonverbal participants by creating a yes picture and a no picture. Prior to the study, the participants had never used yes-no pictures, and it is to be assumed that they did not have the concept of yes-no in their repertoire. Although this may have reduced experimental control, it provides direction for future studies and supplies researchers with a possible alternative to vocal responses of yes and no. In addition, future researchers should take this section into consideration when establishing participants for the program by assessing the children to see if they can discriminate between yes and no before running their reflexive programs or other programs that require simple and conditional discriminations. Also, in reference to the prerequisites of derived relational responding, Emily and Chris exhibited deficits in on-task behavior and establishing attending in others throughout the entirety of this study. If the participant did not respond within 5 seconds, the researcher marked an incorrect response. This poses as a threat to the reliability of the data and may suggest the variations in PC from trial block to trial block. Future research may consider assessing for the prerequisites of derived relational responding and only use participants that meet the criterion of such. To conclude the current study, the results suggest that reflexivity can be derived following direct training of a stimulus set, and that both participants established a transfer of stimulus function to a second set of stimuli unrelated to stimulus set 1. The current study joins the literature on establishing reflexivity in young children with ASD. As well, the study reports on the efficacy of the PEAK e-curriculum in assessing, training, and transferring relational frames. So, where does this leave me in the field of ABA? As I mentioned earlier, my thesis acts as a platform to begin contributions in the peer-reviewed journals. I plan to start with this document and continue to run studies with my clients at work. Being a professional in the field means that it is of great importance to stay progressive in programming and pay attention to the published research. It is also important to work on piecing together the developmental skills that are necessary for each child to function more independently in their day-to-day life. There is a greater love for research when you see the applicable results firsthand. Again, thank you so much for letting me share my hard work with all of you. Below is my contact information. If you have any questions while reading my thesis or reviewing my presentation, please do not hesitate to call me.